Hello and welcome to week 10. This is the last week of our course, not counting next week because it's finals week. Okay, but I do not want you to leave our course, HIM115 Medical Records and the Law, without knowing a few things that might not have caught your eye from your textbook. Okay, but first, this week's chapter, chapter 13, talks about patient rights. So I wanted to make sure that you were clear on the gist of the Patient Bill of Rights as it was recreated in the Affordable Care Act of 2010. So we've now been living with this for about 11 years, and it's really important that you understand, as up-and-coming health information professionals, you need to understand what your patients have a right to, but this is also maybe a little more important for you personally, because you need to know your rights when you are a patient or the loved one of a patient. Okay, so the Patient Bill of Rights requires insurance plans to cover people with pre-existing health conditions, including pregnancy, without charging more for their policies. This is an incredible thing. And if you speak to your relatives who may be older, I don't want to say elderly, but those who are older, especially before ACA, but anybody who was an adult, maybe in the 80s and the 90s, might know about the difficulty or almost impossibility to get a health care policy insurance plan when previous or pre-existing conditions were known, such as hypertension, diabetes, asthma. The insurance companies were particularly against Crohn's disease and ulcerative colitis. Ooh, no way these people were getting any health insurance until 2010. In addition, the Bill of Rights under ACA provides free preventive care. And this is very important. There is a long list, men, women, children, of free preventive care. If you have a healthcare policy, you pay nothing for things such as flu shots and mammograms and prostate exams and things like that. Okay, so that's no copay, no co-insurance, no nothing, just free, right? ACA provides young adults with more coverage options, including something that you might be familiar with, which is that they can stay on their parents' plan until age 25. And no more lifetime and yearly dollar limits on coverage. Yes, there used to be not only your deductible, which is the amount that the patient has to spend out of pocket before the insurance kicks in. Then there used to be limits on how much insurance would pay within a year, as well as within a lifetime. And if somebody needed a heart transplant or a lung transplant, or even chemotherapy, radiation, they could, even with health insurance, they could end up going broke. Those might be some stories that you heard before. Now that has been stopped. Okay. The Bill of Rights continues to assure you as a patient and ensure that you as a healthcare professional, insurance companies cannot just raise rates. They can't just do that. they have to be accountable, which means they have to have a decent reason why. In other words, cost of living increase or something like that, but they cannot just raise your rates. They used to do that too. It's now illegal for health insurance companies to cancel your health insurance just because you get sick. And again, you might hear something like that from an older relative who says, oh, I'm not going to the doctor because if it's such and such or that or this, then my health insurance will cancel me. No more is that permitted. This protects your choice of doctors, and it protects you from employer retaliation in case you want to get a policy through the marketplace instead of through your employer and any other health insurance related problems. And the last 5 little items that are additional benefits under Patient Bill of Rights from ACA: breastfeeding equipment and support can be provided, birth control methods and counseling free. Mental health and substance abuse services, very, 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 very important. I mean, it's always important, and it's good that we talk more about this because, you know, your brain is as important to your quality of life as any other part of your body. And it has been terrible that there has been a stigma attached to needing mental health and certainly substance abuse services. But it's better now because we're talking about it more, and now the coverage is there. Especially after the last year and a half with COVID, and it seems like we're not out of the woods yet. Oh my gosh, this really puts a strain on everyone's psyche. And it's good to have someone to talk about it with, not just a loved one or a best friend, but somebody who is trained to be able to deal with issues of this nature and provide you with important solutions. You also have the right to appeal a health plan decision. So if your doctor says you need a procedure or a service, and the initial claim is denied or request for approval is denied, you have the right to appeal that decision and bring it up to a peer court, which would be a group of physicians who have the same specialty as your doctor, can review your case and maybe say, you know what, this patient really does need this, so we're going to approve it. We're going to overturn that denial. All right. And there are a lot of times when coders make mistakes, and you can appeal that decision as well. Don't just automatically put your hand in your pocket and pay that. You got to ask questions to make sure that's really your debt. And you have that right guaranteed by federal law. And you also, lastly, have the right to choose an individual marketplace plan rather than the one your employer offers you. So you got to remember, you have choices. You can say no thanks to your employer. I don't like that plan, and go over here. And remember that with the new Patient Protection Act, there are healthcare plans in the marketplace since April 2021, just like a couple of months ago, that are less than $10 a month. So do not assume, if you need good insurance, do not assume, oh, it's too expensive, I can't afford it. The last time I looked, the last time you looked was before April, then look again, because there have been many changes in the marketplace, and you are very likely to find something that can actually suit you and give you coverage that you need. Okay. And that's very helpful, very important. Because remember that without health insurance, in addition to the usual, am I sick enough? Do I need to go to the doctor? In addition to that, without health insurance, you got to go, am I sick enough to go to a doctor, and can I afford to go to the doctor? Now you have two things in your head. Whereas if it's not going to cost you any money, or maybe just a small $10 copay or something, then it's better for you go and have it resolved or whatever. But as scary as some healthcare concerns can be, I can guarantee you that delaying care will result in scarier. Okay. All right. So the Patient Bill of Rights has redefined in ACA, and it's important. Excuse. Excuse me. It's important that you know these rights, not only for your patients as a healthcare professional, but also as a patient, as the loved one of a patient. Okay. All right. I also want to talk to you about the False Claims Act, because this is a federal law that is written directly for coders. I mean, this is us. Okay. The Federal False Claims Act makes it a federal offense to submit a claim to a federal agency such as Medicare, Medicaid, TRICARE, containing false information. It's illegal, and you can go to federal prison for it. In addition, virtually every single state, and I think I did read that all 50 states have this, but I always like to say virtually just in case I don't know everything. But virtually every state has its own version, their state False Claims Act, which makes it illegal to submit a claim, a healthcare claim containing false information to any insurer within the state that is licensed to do business within the state. So now the law has been expanded to private insurance as well as federal insurance. The other thing that you need to know is that these charges can be laddered. And what that means is if you are found guilty of violating the Federal False Claims Act, you're not done, because now the people within your state are going to go do their own investigation and get their own pound of flesh out of you. And remember that these illegal acts, filing a claim form with incorrect information, has consequences of fines and penalties, as well as prison or jail time, jail or prison time. Okay. And yes, this is all about the coder. This is not something where the doctor or the administrator of the hospital is going to take the fall, because they're all going to say, but that's why we hired her. She's a certified coder. How could we not trust her? We don't know. Now, ha, ha, ha. Yes, last week you were told directly by the doctor or the administrator or somebody to do this. You have to have the strength of yourself to protect yourself and say, it's illegal and I'm not going to participate, because it's much better to lose your job and get another job than it is to try and get another job after you've done time in jail or prison, as well as all the debt racking up from the fines and the penalties. Okay. And trust me when I tell you, there are no people out there who will tell you to do something illegal. And then when you get caught, they're not going to be stand-up people and say, oh, no, 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 no. I told her to do it. This is on me. My response. They are not going to do that. Because that's not the character that they have. So you need to have the strength to protect yourself. Okay. The thing about the False Claims Act, both federal and state, is written into the law is it's not just submitting a claim with information, false information on it. It's that you knew that it was false information. And the law specifically says knows or should know. It's in your job description. You're certified. You have your certificate from CCTC. You should know. We taught you this. Okay. You should know. Now, of course, because we can't have anything in this entire world that's simple, right? There are actually 3 levels of knowledge. How many? Get toilet paper. I don't know what brand, what kind. Should it be soft? Should be tough? Should it be the big package, the little package? Which brand? Right, exactly. Okay, so there are 3 definitions of knowledge. Actual knowledge, which is knowing for a fact that the information is false. Now, when it comes to coding and billing in healthcare, this becomes a little bit of a gray area, because if you're not in the exam room watching the doctor give that patient that injection, you don't know if the documentation says the injection was given. You don't know if that's true or false. Okay. So you may not have actual knowledge, but you know the character, you know the environment in that hospital, in that physician's office, in that clinic, whether they're always kind of cheating, riding the line of the truth. Okay. Then there's willful ignorance, also known as deliberate ignorance, which is I should know that this documentation is factual and true. And if you, doctor, are going to write something in there that's not true so I can code it to a higher level, don't tell me. I don't want to know. La, 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 la. Don't tell me. I don't want to know, because if I know, I can't do it. But if I don't know, then I don't know, right? That's willful ignorance. You're not finding out the truth because you don't want to know the truth. And that is because you already have a suspicion. You have the truth. You have the truth in your gut. You know these people. You know what's going on in this place. So therefore, you cannot live in willful ignorance. Because when we go back to the wording of the actual law, the law says know or should know. And if you are the person interpreting that documentation into a code and putting that code on a claim form, or passing it to the biller who's going to put it on the claim form, you should know. And that's that. Okay. And the third version of knowledge is disregarding the truth or falsity, behavior that exhibits an indifference to confirming that the information is true. And I'm sad to say that we're seeing a lot of this now on social media, on television, in the news, right? You as up and coming healthcare professionals know that, for example, COVID-19, you should be getting your vaccinations. The vaccine is good. more than 600 million Americans have already died from this. We have a vaccine that can stop that. You need to make sure that your environment, your department is requiring the truth and not ignoring the truth. Okay? And you don't want to, it's another version of willful ignorance, which is not my job. Okay? You can't do this. You are a healthcare professional. You are part of the team. And we all know the trouble with healthcare everywhere, right? I mean, you hear it all the time about the United States healthcare system is broken, and it is. It certainly is. But if you don't step up as a new entry into this profession and do what you can to make things better, to improve things, then what are you doing? You know, it's that old saying, you're either part of the problem or you're a part of the solution. I want you to be part of the solution. Just, you don't have to fix the whole thing. Just fix your little spot. Okay? You can do it. You have the knowledge. I know, because I've participated in giving you the knowledge. Pretty tricky of me, huh? Yepper. All right, there's one more thing I want you to be aware of that is included. It's actually included in HIPAA, and it's known as the key TAM provision, and you'll see it's QUI, but it's pronounced key, KEY. That's what I put that there for you. Okay. The key TAM provision is also known as the whistleblower statute. And this is the federal government protecting you. If you see something, say something. If you are working in a doctor's office and they keep overbilling, the insurance companies and the doctor and the office manager, like, they're not going to pay attention to us. We're this little doctor's office in Podunk, South Carolina. They don't even know we exist. Okay. All right. But not only do you do the right thing, which is good for your heart and your soul, mind you, but you can earn between 15 and 30% of everything that the government collects after they go in and they audit and they say, thank you, ladies and gentlemen, you owe us $17 million. You could have 15 to 30% of $17 million. And I shouldn't have picked 17 because I can't do the math in my head. But okay, 17 times 3 is 1, 3, 5, 51. Oh, $51,000 you get for telling the truth, protecting your patients, for preventing people from stealing money. That's a good reward. I don't think that's right though. 51, 50, I'll figure it out. 500, that's it. It's $510,000. It's not 51,000. It's $510,000. Not bad, huh? For doing the right thing. Okay. All right. So I just wanted to make sure you knew all this and you were paying attention to this because it is directly applicable to your future success. And it's also important for you to know as a patient. Okay. All right. This week is chapter 13. You know the routine. There is a handout, a summary of the Federal False Claims Act if you want to just kind of get familiar with this. And remember, we have this week, chapter 13, regular stuff. Okay. And next week, how exciting! The final exam. Oh my gosh. Yes. Yes. Okay. Do you have any questions?
No, no questions.
Okie dokie then. You know where to find me if you do have questions, right?
Yes.
Okay. Well, there you go. Have a wonderful evening. Keep
You too.
safe.
All right. Thank you,
And
doctor.
and I'll see you in the course room.
Take
Oh,
care.
you too. Bye.
Bye-bye.